So today we will discuss the nutrition in cardiovascular and heart disease, in addition to another topic, which is the food allergy and intolerance. Um, as you know, there's a lot of nutritional intervention. Let's say when you have a patient coming to you with a heart or the cardiovascular disease, a problem, you will have some suggestion or it come to your mind that he needs to follow a specific diet. And this is why it is one of the topic that dietitians come to, and even physicians will interfere and get some nutritional advices in this regard. As a start, we know that the cardiovascular disease is a general term describing diseases of the heart and the blood vessels. The coronary heart disease caused by atherosclerosis in the coronary arteries, and this will interfere with blood flow in these arteries, which lead to lack of oxygen and nutrients, which may lead to myocardial infarctions. So what are the causes? As you know, it's inflammation, infection, hypertension, cigarette smoking, elevated LDL and VLDL, diabetes mellitus, age, and gender. There's a major risk factors for the coronary heart disease. Some of them are modifiable and others are not. The not modifiable is the increasing in age, male, and family history. The one that we can modify is having a high LDL and low HDL. The atherogenic diet, this kind of diet is the high fat with low vegetables, low fruits, low whole grains, what the meaning is low fiber diet. Obesity, specifically abdominal, and this is why most of the or the risk increase also with male, because most of the male obesity is with an abdominal area. Hypertension, diabetes mellitus, physical inactivity, and cigarette smoking. So in order to make an intervention, we need to advocate lifestyle changes in order to lower the risk, or if they are already been diagnosed, to at least reduce the side effect and save whatever we can do. The first one is to limit the saturated fat to less than 10% of the calorie. The saturated fat had been advocated for several years. In the past few years, there have been a new controversial discussions regarding, is it actually bad for our arteries or not? Anyway, just to put you or to make you understand, I'm sure you took this already with Razan, but as a reminder, whenever you take high fat diet, it will need to be transferred in your body, and here come the HDL and the LDL. So the type of fat you are taking will make your body produce the needed cholesterol in order to transport this fat. So if you are taking a good kind of fat, this will increase your HDL, which is good for you. But they're saying if you're taking a bad or high saturated fat, this will need more LDL to carry. But the new studies show that what affect our arteries more is the triglycerides. And as you know, the triglycerides usually get elevated when we are having a high carbohydrates diet, not a high fat diet. So if I want to reduce the triglycerides, I need to work on the amount of carb in the diet, not the fat. Again, the discussion, or for years, people have been avoiding butter, ghee, and any kind of saturated fat. And they went to find other solutions, which came the margarine, in which they took an oil and they added a certain kind of a procedure in order, or a process in order to make it look like a butter, thinking that this is actually better for us. And as you know, it produces trans fat, which is worse than saturated fat. And in many countries, there's a lot of restrictions on the amount used. And the amount in each kind need to be written in the label, food label. And in some countries in Europe, you cannot sell a product that have more than 5 gram trans fat. So per serving. So trans fat is more harmful than saturated fat. And saturated fat still, or it's proven in the last few years, that's actually not the one affecting us. There was one in 2000, I think, 10. There was a magazine, the Time magazine cover showed a butter and saying butter or not to butter, in order for researchers to look more into the effect of saturated fat. And I'm telling you, in a lot of the nutritional conventions and the symposiums, they always have two group discussing either it's good for us or it's bad for us. But until now, still the recommendation is to have the fat intake within 25 to 35% of the total kilocalorie, and it's preferred to reduce the saturated fat and take more polyunsaturated fat, and they call it, the good type of fat. The recommendation to increase monounsaturated and polyunsaturated fat, which is from fish, vegetable oil, and nuts. Take food high in soluble fiber, oat, barley, legumes, and fruits. Take whole grains, legumes, fruits, and vegetables. To lower the intake of sodium and to increase physical activity. The last one is to reduce weight. Why reduce weight? Because whenever the weight go down, there will be less fat in your body and definitely less pressure on your heart. And definitely reducing weight is good for your heart and for your well-being. Any questions? We will move to the hypertension. The factors that contribute to hypertension, again, aging, genetic factors, obesity, salt sensitivity, alcohol intake, and dietary factors, which is low potassium, magnesium, and calcium. So what I'm saying here, that some of the individuals would have salt sensitivity, not everyone. And this is around 30 to 50% of the patients with hypertension. They will respond to the salt intake. Remember, we took this when we studied the minerals. While others, even if you reduce their salt intake, their high blood pressure will not go down, or their hypertension. For the dietary factors, the study showed that if you had a lifestyle low in potassium, magnesium, and calcium, those important minerals, if you remember, one of their functions when we studied the mineral presentation is to control blood pressure. If you have those, that means they will have a higher risk of hypertension. There's a question, what about the high cholesterol containing food like egg and shrimp for cardiac patients? Until now, the American Heart Association is asking us to control the amount of high cholesterol food for patients with heart disease. But generally, for normal population, there's no restriction of the amount of food that contain cholesterol, because it does not matter how much cholesterol you take from food. The amount that matters is how much you produce, which is again back to fat. As you know, cholesterol is the fat carrier, it's not the fat itself. And all the idea of having saturated fat and cholesterol started when they conducted a study on farmers in the United States. While farmers, as you know, they eat a lot of high fat, a lot of eggs, and they don't have any problems. So they said, okay, they are having 6, 7 eggs per day, and they don't have a cardiac problem. Of course, the level of activity play a role. We know that, but definitely, this high cholesterol did not affect their arteries as how we've been expecting it. So still for cardiac patient, we tell them to control the amount of cholesterol, but for the normal population, no. Does this answer your question, Lean? Okay. So for the treatment of the hypertension, we had to do both lifestyle modification and drug therapies. Most of the time, the physician will ask the patients to make some lifestyle changes before he start on medication if or on drugs if the blood pressure raise is not that high. First, we will ask them to try to reduce their weight, because reducing weight will reduce the systolic blood pressure, and that will benefit them for sure. We ask them to increase fruits, vegetables for the fiber and for also the antioxidant. They should lower their fat intake by taking low-fat dairy products. They should increase their whole grains, take more poultry, fish, and nuts. And this is called the DASH diet, which is the dietary approach to stop hypertension. We will talk further about this diet in the next slide. Generally, the diet will increase the intake of fiber, potassium, magnesium, and calcium. And to recommend to reduce sweets, because generally most of the sweets have a lot of sugar. And again, as I told you, the sugar will increase the triglycerides. And most of the sweets contain trans fat and high fat in it. In addition to sugar containing beverages, like those new drinks that it's everywhere, Kedo, I don't know, a lot of drinks now it's in the market with high containing sugar. Of course, this includes soft drinks. Reduce saturated fat again, and reduce sodium intake. If we're going to talk about the DASH diet, this kind of diet help to control the blood pressure. It includes, this is also a kind of diet that people should take in order to prevent developing hypertension in the future. It includes whole grains, fish, poultry, beans, seeds, nuts, and vegetable oils. It should limit sodium, sweets, sugary beverage, and red meat. It emphasizes the vegetables, fruits, and fat-free or low-fat dairy products. In regards to this, the National Heart, Lung, and Blood Institute, they worked on with 5 of the most respected medical research centers in different cities in the US in order to do a large, detailed research. The initial DASH diet started in August 1993 and ended 1997. But they wanted to test it and developed more to see exactly which kind of macronutrients intake that will affect the heart health. This is called OmniHeart diet. Okay, those are included in your note also. You can look at it. So what they did, they took the 3 macronutrients and divided people into group to see which macronutrients will improve the blood pressure, lower the blood pressure, and improve the blood levels. All 3 diets had been followed the principle of DASH diet, with one macronutrients to be higher than the others. So we have one group high in carbohydrates, the second high in protein, and the third is higher in unsaturated fat, while we keep the calories level the same. So what happened? What the results showed? The study actually showed that the protein-rich has the best result, and then the unsaturated fat-rich diet. They provided additional benefits to the blood pressure and blood levels, and further reduce estimated 10 years risk of heart disease than the carbohydrate-rich diet. This will tell you something. For several years, we have been following a high carbohydrate diet, because when we tend to reduce our intake of fat, we shifted to bread, right? More than shifting it to. And we heard a lot of people saying, no, we should not take red meat. We should reduce the intake of protein. When I was growing, there was a lot of talk about that elderly should take minimum amount of protein in order to save their kidney. Definitely, this is not correct. This is not accurate. Having high intake of protein will not affect your kidney, because if you took more than what you need, you will excrete it, and it will not affect your kidney unless you have a kidney problem or you have a family history that you may develop in the later on. But taking high protein diet will not affect your kidney. One thing worth mentioning, that we think that we take enough amount of protein, but actually, if you look to our new eating pattern, you will find that no, we do not. Like an average, a minimum amount is 7 grams of protein, 7 exchange of protein per day. This is a minimum for a female, which she should take from dairy products, from meat, fish, or meat, fish, or chicken, and from legumes, right? Those are our sources of protein. Most of our population, they don't take enough, even if they are having, unless they are having a meat meal, like on lunch, they are having steaks or chicken. But generally, people tend to have lower protein that they need. And this is without us noticing. It became part of our practice. And when they told us to reduce cholesterol, as an example, people not eating eggs as they should be. You know, some people have eggs once a week only, and a lot they are keen not to have meat or protein every day. They will have pasta, they will have a sandwich, a cheese sandwich only, which will contain only 30 grams of protein. I mean 7 gram protein, because the one slice of cheese will give you 7 grams. So the recommendation until now is to give 1 gram per kg per day. And if you're doing more exercise or you're active, you can go up to 1.5. For elderly above 60, they should take around 1.2 to 1.5. So are we taking enough? I'm telling you, no. Try to watch your intake of protein, and you may notice that. And try to look and think, how can I get enough protein in my diet? Any questions? Okay, so now we will talk about the nutrition therapy for heart failure. It's almost similar, except for heart failure, we need to be very careful on the amount of sodium they are receiving. They should not exceed 2000 milligram, and in order for us to reduce the fluid retention. Sometimes we do fluid restrictions. They should eat small, frequent meals, because they get tired if they had a big, fatty meal. They should maintain adequate fiber intake in order to reduce their constipation. We do some caffeine restriction, because it can worsen their heartbeat and irregularities. They may be on cardiac or at risk of cardiac asphyxia. In those cases, you would have a patient waiting for heart transplant, and his BMI is 14 or 13, especially young ones. We can give them supplements, we can put tube feeding or even TPN if the patient is unable to increase his intake. Any questions before we move to food allergy and food intolerance? Okay, for the food allergy and food intolerance, we noticed for the caffeine, usually they are allowed to have 2 cup of Arabic coffee. Okay. So maybe 1 small cup of coffee in the morning and 1 tea. Some of them we ask them, depends on their symptoms. Some of them we stopped it at all. Um, Not to take any caffeine, zero. So it depends on the case. Any more questions? Okay, for the food allergy prevalence, it's almost double in the last 20 years with a defined increase in severity and scope. The adverse food reaction, it includes food intolerance and food hypersensitivity. For the food intolerance, it's an adverse reaction to food caused by toxic, pharmacologic, or metabolic, idiosyncratic, or non-immunoglobulin reaction to food or chemical substance in the food. So I have no immunoglobulin reaction. For the food allergy or the hypersensitivity, it's an IgE mediated reaction and it occurs when the immune system reacts to a normally harmless food protein that the body has mistakenly identified as harmful. Usually it occurs within 2 hours, and so it is a short onset. Here are some of the examples of the different kind of reaction, if it's an IgE mediated, if it's a mixed mechanism, IgE and cell mediated, or if it's a non-IgE or cell mediated. For the timing, the IgE mediated within minutes to 1 hour. If it's a mixed, it could take up to 2 hours. And if it's non-IgE or cell mediated, it is definitely more than 2 hours. If it's generalized, usually the anaphylactic shock or the food-dependent exercise-induced anaphylaxis. The food-dependent exercise is when a person or take a kind of food that he usually eat after exercising that may reduce a shock for him because of that. We had one incident 2 years ago. It's a son of one of our physician that had been playing basketball with his team. And after that, he had some, I can't remember the kind of food, but it's a normal food for him. And then he got this severe reaction. Cutaneous urticaria, angioedema, flushing, acute contact urticaria. This is IgE mediated. For the mixed atopic dermatitis and contact dermatitis, for the non-IgE, it could be the dermatitis herpetiformis. This one also, it's non-IgE or cell-mediated. For the gastrointestinal, you would have oral allergy syndrome and immediate gastrointestinal food allergy. So if you gave a patient who have cow milk allergy a cow milk, he could develop diarrhea immediately, okay? For the mixed mechanism, it could be allergic eosinophilic esophagitis. This is relatively a new disease, maybe 10 to 15 years. It involves food allergy that showed as or symptoms showing as vomiting or bleeding, severe reflux. Before they never related it to food, and they think it's only a reflux. And we had several cases when we, especially with pediatric, when you stop the dairy product, their symptoms will improve. Mostly it's related to wheat and milk. For the non-IgE, allergic protocollitis, food protein-induced enterocolitis syndrome, like developing constipation after taking dairy product. Actually, not everyone develop constipation after taking dairy product, only the one that have a kind of intolerance. It causes for them a severe constipation. Celiac disease, infantile colic, having cramps. For the respiratory, bronchospasm, acute rhinoconjunctivitis, both of them are an IgE mediated. For the mixed mechanism is asthma. So not everyone is linking a food allergy to asthma. For the non-IgE is the Henry's syndrome. For the symptoms, we have skin, respiratory, cardiovascular, gestational symptoms. The food-induced anaphylaxis, as you know, is the most severe one. It's an acute, often severe, and sometimes fatal immune response occur within a limited time following exposure to an antigen. Systemic anaphylaxis is the most dangerous allergic reaction, and the patients who have this or at risk of having it should have epinephrine with them. Symptoms of food allergy. For the gastrointestinal, abdominal pain, nausea, vomiting, diarrhea, gastrointestinal bleeding, protein, losing enteropathy, oral and pharyngeal pruritus. I'm not sure about that, and I can see it clearly. Cutaneous manifestation, again, we already talked about it, having eczema, urticaria, itching, flushing. Respiratory manifestation, rhinitis, asthma, cough, laryngeal edema, milk-induced syndrome with respiratory disease, which is Henry syndrome, airway tightening. Systemic, again, we talked about it, and there's some controversial or unproven manifestation, behavioral disorders, tension fatigue syndrome. For a behavioral disorder, they are linking hyperactivity for children with receiving caramel coloring. Like if you gave soft drinks, Pepsi or cola, because it have caramel color, or strawberry ice cream, because also it has a kind of coloring, food coloring, they may become hyperactive, and it may also lead to insomnia. One time, my daughter was 3 years old, and she used to sleep on time, and maximum at 8, or maybe before 7:30, something like that. One time, I was not home. They ordered for them Happy Meal, and with the Happy Meal, it came, I think, Pepsi. So I came home, and it was 12, and she was awake, and she was unable to go to bed. She was full of energy. And then I discovered that she had some of the Diet Coke. Of course, she never, the Coke, she never tried it before. She's not allowed to, but because I was not home, she had it, and she could not sleep that day. So, and some of people take soft drinks to wake up. They think it's from the caffeine alone. It's not from the caffeine alone. It's also from the coloring. It make them hyperactive. Tension fatigue syndrome. attention deficit and hyperactivity disorder, they said maybe if you reduce sugar they may improve, or they were related again to certain kinds of food coloring. Otitis media, psychiatric disorders, neurological disorders. As you know, I'm sure you heard about the link of autism and some kind of food. If they really autistic patient, they will not improve in reducing casein and wheat, but they may have some pediatric may have symptoms similar to autism, while it's a kind of food allergy. Musculoskeletal disorders, migraine headaches. For the migraine, as you know, it's becoming a large numbers. I think there's a lot of people that are developing it recently. Um, can you give me a minute, please? Okay, for the migraine, it's really becoming like I know several people that been developing migraine or their headache, and then they're diagnosed with migraine. One of my friends, she had it for several years, and now she tried to link it with certain kind of food, and she noticed that whenever she's taking wheat, she would develop migraine. So she stopped all wheat. And she's following a gluten-free diet, and actually she improved, um, and she's not having any attacks of migraine after she stopped the gluten. So it could be still under study, but it's worth trying it for some kind of patient. Okay, if we're going to discuss the risk factors for developing food allergy, we have family history, exposure to an antigen, GI permeability, environmental factors such as microbial exposure. What I mean by that, an example, like if you have an infant who develop gastritis, or he develop diarrhea for any reason, after that he can develop cow milk allergy. He will be unable, or she will be unable to tolerate dairy product or milk for some time. For the GI permeability, they're saying our food, our new food is the processed food. It's increasing our GI permeability, and this is making our body have a severe reactions to normal antigen. Okay, this is the theory about it. Sorry, I think I'm muted. Where did I get muted? What's the last thing you heard me saying? Did we talk about those? The GI permeability? Class? Did I talk about the GI permeability? Okay. We talked about the environmental factors, right? And we gave an example that if someone developed a diarrhea, an infant, he could develop cow milk allergy later on. Okay. Diagnosis. How can I diagnose as a food allergy? First thing, I need to take the clinical history. First exposure may occur during pregnancy, lactation, or early childhood, meaning that I could be taking this food for a time, a lifetime, and then when I took it as a pregnant, it caused a kind of reaction to me. Physical examination, this include growth for pediatric. Is he growing well? An example is the one with cow milk allergy, because if he's developing diarrhea, definitely he's not going to grow well. Or if he's having malabsorption problems, he might have malnutrition, or it may affect his or her growth. Because as we say, the symptoms are different. Some of the celiac disease, actually, some of the pediatric got diagnosed because of their short status. So they are short. They don't have any other symptoms. They are just short. And when I receive those patients in my clinic, I will run several labs. One of them is the celiac disease profile in order to see if they have a risk. If I have them, the IgGs are high, I will refer them to GI in order to do the endoscopy and confirm diagnosis. Food and symptoms diary. So we will ask them to link the symptoms to certain kind of food. Did you eat something and you felt that this is the reason? Biochemical testing, complete blood count at differential. If he's having a celiac disease, he would have anemia. If he's bleeding and we're not noticing, he would have anemia. We would do stool culture and blood. In this tool, we do pH also to see if they are having lactose intolerance. We do a sweat chloride test in order to diagnose also cystic fibrosis. We should do immunological test again to see if they are having reactions. Food elimination diet, we will ask them to follow or to start eliminating most of the food from their diet. They can take rice at the beginning and then start introducing food slowly. Chicken, meat, potato, those are the food that have least of allergies, dates, and then they start introducing food slowly. First, we can do something as eliminating the high-risk food, which is dairy product, wheat, nuts, eggs, banana, strawberries, mangoes. A lot of fruits may cause, that will known to cause a kind of allergy, kiwi. And then we will eliminate those high allergenic food, monitor the symptoms. If they did not improve, we can go further. The food challenge is to bring certain kind of food in the clinic with the patients and ask them to try it. This is a little bit dangerous, but it has to be done in an area where there is physicians and the team are ready in order just in case this patient develop any reaction. Those are some of the diagnostic tests that is used. Some of them are well known, and just give me a second, I will mute. Sorry. Okay. So one of the most used one is the skin test, the prick. It's actually more accurate than the other test. We have the RAST. We do RAST, and if I have positive to allergy or positive sensitivity, it do not confirm 100%, but it raise the risk, and then I can eliminate that food and monitor the symptoms. It's more expensive, and it has a lot of options that will help you do one test with several kind of food. For the double-blind placebo-controlled food challenge, this one is the gold standard for allergy testing, but actually it's a little bit challenging. One time we did it for one of our patients with cow milk allergy because he was disliking his milk, which is an amino acid based formula. So the physician thought, let's try another kind of formula in the clinic to see if the baby is going to tolerate or not. And when we do the food challenge, of course, that's not a double blind, but it's a food challenge. Again, he developed symptoms. He developed anaphylactic shock in the clinic. Of course, the team were ready, but the baby really got sick. The double blind, they will put several kind of food. The patient will not know what is this food and see the reaction will come from which kind. We had also one son of one of the physician who suddenly he developed a severe allergy. They didn't know from where. They looked into the food he took on the same day. There's nothing new. And everything was made at home. They had the burger made at home, but the patties is from a shop that they will always get that from. Anyway, after several weeks, he developed a severe reaction, and on that day he had the same burger, the same patties. So the father, of course, linked it to the kind of meat he's taking. He went to the shop and he asked them, and he just discovered that they added a new herb in the preparation of the meat, and this kind he caused him this severe reaction. There's a question. Sudden change of diet? No, I don't think so. It has to be an antigen, something in the food that will lead to this reaction. Okay, so the treatment. First, we should avoid the food that is causing this allergy. Okay, it's the only treatment, just avoidance. But we need to look into what kind of food I removed. And I need to replace this kind. Like if I am removing the milk, what should I provide instead? Especially for pediatric, even if adult, if I'm not taking any dairy product, I'm at risk of osteopenia. So I need to take calcium, okay? Other kind, maybe you will find alternative. Like if I've had allergy from eggs, I can eat meat and take protein from there. The wheat is a little bit difficult, but alhamdulillah, recently we have a lot of gluten-free product, and patients, Saudi patients who's diagnosed with celiac disease will receive a budget from the ministry, not Ministry of Health. I'm trying to remember the name of the ministry, which is وزارة الشؤون الاجتماعية. They will receive around 11,000 real in order for them to buy a gluten-free product, because as I know, it's more expensive. The third intervention we will do is to make sure they are not developing any deficiencies. due to this allergy, okay, or to the removal of a certain kind of food. The common food allergy is the cow milk, egg, peanuts, soya, wheat allergy. And there's some of them would have a kind of interaction. Like if you have a patient with cow milk allergy, it's not recommended to give them soya because they have a risk of developing allergy. So we have to be careful in introducing and picking what kind of formula or what kind of milk. You will tell me, but there's a lot of people who's having cow allergy and they are taking soya milk adult and they're surviving. Yes, it is, but I have to be careful for the first time at least. Cow's milk allergy, it's common for infants. A study suggests that some cases of constipation and vomiting are related. Again, reflux and constipation could be related to a cow milk allergy. Recommendation, if confirmed, the baby should only take amino acid-based formula. Some babies can tolerate human milk or extensively hydrolyzed cow milk formula. They will be able to tolerate it. It's not recommended to give goat milk because goat milk actually have similar content of the cow milk. And the second one is the soy-based formula because soy-based formula may increase the risk of osteopenia. Because remember, when we talked about the absorptions of minerals, we talked about some inhibitors of this absorption. Some of them are the phytate, which is rich in soya. Okay. What can we do for the sensitivity to mother milk? This can cause allergic reaction, example, atopic dermatitis. So I have a baby, he's having atopic dermatitis and he's only breastfed. What can we do? First, we ask the mother to do or eliminate the certain kind of food from her diet, like cow milk or dairy product, eggs, peanuts. If it worked, if it did not work, and the baby continued to develop allergic reactions, we will ask or we will switch to extensively hydrolyzed formula. One of the examples, we had of patients with severe atopic dermatitis or a severe eczema, let's say. And we asked the mother to do an elimination diet. The baby had started improving. And then one day he got it all over again. And at that day, the mother had eggplant. So the baby have allergy from eggplant. And when she took when she ate the eggplant, when she started reintroducing food to her diet, he developed that. Non-allergic reaction. This is usually it's a GI upset. What can we do? Again, we can do some kind of elimination diet. We tell them to reduce caffeine, chocolate, herb tea, cabbage, onion, turnip, or most of the food that may cause gases. Patient with colic, again, still the association between food allergy and colic is controversial, but it appears that it is a non-IgE or cell-mediated reaction. Just a second. Okay. If they have a persistent colic, so I have a patient who is his colic is really severe, and this is affecting his intake. I will ask the mother, if he's on breastfeeding, I will ask her to do elimination diet. If it did not improve, I can try extensively hydrolyzed cow milk. If it improved, that means it's related or a kind of intolerance. If he did not, I can try amino acid-based formula if it's really a severe colic. We reached the end of our presentation. Any questions? If you have no questions, we will end today. And I think this will be my last lecture. And Dr. Razan will present next week. And then after 2 weeks, you would have your final exam. Wish you luck. And if you have any questions, please send them to me. Thank you. Eid Mubarak to all of you.